Another question.
Sure.
Yeah. On a radiograph, X-ray, is there a difference between active Paget's disease and Paget's that's more in a remissive state? Do they look different?
Um, yes and no. Like early on in Paget's disease, the bone can show it's called what's called a lytic area. In other words, it on the X-ray it's like dark, like there's not new bone formation. Whereas in most people with Paget's disease, there's some dark areas and white areas. You know, it's a mix. And I would say 90% of people with Paget's disease are in that mixed phase. You know, there's some dark areas and light areas. In another maybe 5% of people, there's no dark areas. No dark areas. It's all light areas. And that's in the disease where there's maybe not much activity. So the answer is yes, they do look different. But for the vast majority of people, because they're in this mixed phase, it's difficult to know what's going on. And that's where the bone scan comes in telling you if there's any activity. And yeah, so it's a better test. It would be better than an MRI scan, I would say, which maybe usually looks at anatomy, or a CT scan, which mainly looks at anatomy. So the bone scan, although it's fallen out of favor in a lot of disease areas, it's still pretty useful in Paget's disease because it gives an indication of how much what's called remodeling or how much activity there is. So it's a pretty useful technique, actually.
Okay. Well, I had a bone scan recently and it showed activity,
Okay.
but it's not bothering me, so we're not doing anything about it right now.
Like I said, I think that's fine, basically, if you're not
Mm.
having any symptoms.
Does it ever just resolve on its own?
Um, I think probably.
Okay. And then it could come back another time and be
I
painful.
guess I guess I mean that's why I like to keep people with Paget's disease under surveillance every so often.
Yeah.
And we see that in a lot of rheumatological conditions. Someone's doing fine and then things flare up. So yeah, it can come and go. It can come and go, and I think that's why it's important, to be kept under follow-up, basically.
Yeah. Well, I am. I go at least once a year, sometimes twice to the rheumatologist.
It sounds like you're getting a good standard of care.
Yeah, I am. Thank you.